Next question. Now, you have a 32-year-old male with HIV infection. He presents with multiple purple lesions on the skin. This one, as soon as you see this, we've already gone through it. And oral mucosa, his CD4 count is 120 cells per microliter. What's the most likely diagnosis? I've taught you this. Purple lesions on the skin and the mucosa. What is the most likely diagnosis, doctors? What's the most likely diagnosis? Purple lesions on the skin and the mucosa. Purple. As soon as you see HIV patient with purple lesions, what should go into your mind? Purple lesions. Dr. Nika, no. We've already dealt with this. Purple lesions, we've already dealt with it. Purple lesions. We've already dealt with purple lesions, Dr. Nika. Please, we've already dealt with purple lesions. So purple lesions should point me to just one thing and one thing only. And that should be Kaposi sarcoma, right? Purple lesions should be Kaposi sarcoma. So even if you are sleeping, and okay, so I have another question. In the comment section, please type this. If I say the patient has white lesions in the mouth and I can scrape it, what diagnosis are we thinking about? Please type your answer. Type your answer. Go. Now we are looking at specific descriptions for specific conditions, right? So purple lesions, we said it's Kaposi. What about white lesions in the entire mouth? Beautiful, Candida. Okay, what about a white lesion on the side of the tongue which you cannot scrape? White lesion on the side of the tongue which you cannot scrape. What is the answer? Beautiful. Dr. Maria says that is oral leukoplakia. So we are picking it up. Oral leukoplakia, right? Now, what about bacillary angiomatosis? Bacillary angiomatosis presents with reddish vascular lesions that can look similar to Kaposi, but usually occur in different patterns, and you can differentiate that from Kaposi with histology. Next question. 29-year-old female with HIV presents with visual disturbances. Fundoscopy exam reveals retinal hemorrhages and cotton wool spots. Her CD4 count is 30 cells per microliter. What's the most likely diagnosis? A, herpes simplex retinitis. B, cytomegalovirus retinitis. C, toxoplasmosis. D, HIV retinopathy. What's your answer? What's your answer? What's your answer? Are you going with herpes simplex retinitis? Are you going with cytomegalovirus retinitis? Are you going with toxoplasmosis? Or are you going to go with HIV? It looks like the jury is out. Some people are going for B. Dr. Danita is going for D. Dr. Felix Ikina is also going for D. What's the correct answer? The correct answer is B, cytomegalovirus retinitis. Number one, remember that I taught you that, and I will go to that table. We are not there yet, but I remember I told you that there are some specific conditions which go with specific CD4 counts. So you must know the conditions which come up when CD4 count is less than 200. Conditions which come up when CD4 count is less than 100. And conditions which come up when CD4 count is less than 50. This patient's CD4 count is 30 cells per microliter. And the patient is presented with retinal hemorrhages and cotton wool spots. Of all these presentations, the one which will come up when CD4 count is that low, plus cotton wool spots and retinal hemorrhages, is cytomegalovirus retinitis. Cytomegalovirus retinitis. So, Dr. Ronnie, D is not right. Dr. Aaron, D is not right. Right? The correct answer is B. B. Okay, good. 35-year-old man with untreated HIV presents with CD4 counts of 45 cells per microliter. He has developed persistent non-productive cough, fever, and shortness of breath. His chest X-ray shows bilateral interstitial infiltrate. I think we've already dealt with something similar. What's the correct answer? What's the correct answer? Everybody should know this. What's the correct answer? When we say bilateral interstitial infiltrate, we should know it. It's pneumocystic urethritis. That one, we know it for sure. PCP pneumonia. We know that for sure.